Hello and welcome to this short demonstration of the Health Information Exchange as being developed by Newcastle Hospitals on behalf of the Great North Care Record. Just a quick reminder before we actually have a look at the product that what you're about to see is a test environment, and what I'm trying to demonstrate is what the product's going to look like and some of the features that you can expect to see. All of the patients, the data and the scenarios that you see are not real, and the categories and the data sets represent the vanilla out of the box HIE as provided by Cerner, and may not reflect either the finished or the original go live HIE that we have in the Northeast on deployment. But that said, let's move on and I will show you what the product looks like. It is intended that whatever system you have in your organization, you will be using your standard system, and you will be either with or just about to see a patient, and you will be viewing their details in your own system, and you will now get an additional option which allows you to view the Great North Care Record HIE, and when you either push that button or choose that menu option, what you will see is something that looks a little like this. The HIE has gone away, it's gone to all of our connected data sources, and it's pulled back all of the information it can find for our selected patient, Sarah Jordan. It categorizes that information, and then for each category it's displaying on the screen what I'll call a component with the relevant data set for that category laid out for us to look at. As you can see, we get quite a lot of information returned, and how do we perhaps limit, how do we filter what we're seeing to find the information that we're most interested in? So we have a couple of options along the screen, you can see here. So at the minute we're seeing all records, everything that the HIE can find. I can open this drop down box and I can say, well, I'm really only interested in anything which has happened in the last 6 months. So if I choose 6 months, you'll see now what happens is the data gets filtered, we get a lot less data. These components, if there's nothing to show, they all close up. And we can see that in the last 6 months we've got a lot less data to look at. So that's one way we can find our way through the vast amount of information to try and find information that's relevant to us. Another way we can filter the data is by data source. Now in this test system, this isn't very relevant. The test system only has 2 views into a medical interoperability gateway. But I will show you, for example, in our case in HIE, this might be, you might only want to see records from Newcastle Hospitals, or you might only want to see information from County Durham and Darlington. You would see all of our connected data sources listed, and you could choose which sources you wanted to use to see the data from. So in this case, I'll deselect this view into the MIG, and when I click apply again, you'll see a lot of the components close up because they've got nothing to show, and we can see the only data we're getting from that view of the MIG is this data set here. So again, we can choose by date or we can choose by data source. So finally, I'll show you a very effective search mechanism. There's a search box in the top right hand corner. We can choose to search through any reports which have been included in the HIE, and let's say I'm particularly interested in anything to do with renal function. I can simply type renal, I could type the name of a drug, I could type the name of a condition, I simply pick a keyword, and when I search again, you'll see that the HIE sorts everything, filters everything for me, and only shows me those records it can find that have that keyword in it. So we can filter by time, we can filter by source, or we can just search for keywords, and I think they're pretty effective ways that we can limit what the HIE is showing us to help us find the data that we need. And what I'll do now is I'll talk about ways in which we can use these components. All of these components have some common traits, some common usage, and we'll just go through that now. So you can see, if I look at this medications component here, I'm looking at the summary view, and I've got a list of the drugs that this patient has had. However, you can see if we look here, it's telling us that this component is sorted by medication, so I'm getting an alphabetical list. That might not be the most appropriate. I might want to see, well, what has the patient been taking recently? And I can click on any of the column headers, and you can see now I have the list of medications not sorted alphabetically but sorted by date. As I say, this is the summary view, and if I hover over any particular item, you'll see that I get a pop-out box which tells me a little bit more and shows me all of the information for that particular row. Now, this might not be appropriate to have to see this pop-out box for one record at a time. I might want to be able to compare, and if I click, I can have a detailed view, which you see then gives me all of the data for that component. But again, this is perhaps not the most pleasing on the eye, and every component has a little arrow which points to the top right, and if I click on that, it will pop out this component and it will go full screen. And what you'll see now is I get a much much easier to use view of the detailed data for that category. Perhaps a component where we get better view of that pop-out capability is if I look at the lab results component, where you can see we have lots of records, so we have multiple pages, and again I'm only looking here at a summary view. So first of all, if I pop that out, first of all you see we get a lot more results on the page. You can see straight away some of these items are in green, some of these items are in blue. That's an indication straight away that a green result is within the normal range for that test. A red result is above the normal threshold for that test, and although we're not seeing any on this screen, a blue result would be a test result below the normal range for that test. So again, as I say, we're looking at the summary view here. If I look at the details, I now get all of the information we have about those tests. Or perhaps more interesting still is what Cerner are calling the graph view, where we see this is the most recent result for any particular test, and then the history of those results. As we go back in time, what have those results looked like? And if I stop here, you can see we've got some greens and some reds, and the reason it's called the graph view is if I click on that row, then that's exactly what I get. I'll get a graph of those results over time. Every component is giving us the name of the category, and it's showing us how many records there are and how many are on display at the moment. What if there are categories that I'm not particularly interested in? Well, again, you can see every component has this upward pointing arrow, and that allows me to collapse this component, and if I click, that component is closed. It shows me that there are some records, it shows me that there are some details, but it's not showing me the detail. That's in contrast to some of the components at the bottom, where they're not only collapsed, but you can see they're kind of grayed out, and that's because there is no data to show. So I can't expand those because there's nothing to show. But with some components, I can choose to have them closed by default, and then if I want to see the data, I simply open them up. But by default, allergies is closed. That allows me to make best use of the screen. What happens if actually I'm not interested in allergies at all? I would rather have that. It would be there if I needed it, but I don't need it to be front and center. Well, any component, if we pick this title bar, we can move its position on the screen. So I can drop allergies, I can drop it right to the bottom. I might be I might think that actually vital signs are the things that I'm most interested in. I'd like vital signs to be front and center. So I will put vital signs there. The HIE now is going to remember this as my default view. It's going to remember that I want to see vital signs front and center. It's going to remember that I want allergies down at the bottom, and it's going to remember that I want it collapsed by default. This will become my personal view, and the next time I log into the HIE, this is the view I will get.